us two case studies from the book what are your favorites?
So the case studies in the book are handpicked, and they're all pretty dramatic. I think there's one that's not so dramatic, but really makes a good point. So let's see. I really like the case study of the woman with fibromyalgia who came in, who was completely miserable, not feeling good. She'd come in actually from another state to see me, and walking in like an old lady, and couldn't, just pain, not working because she was in so much pain. And she was drinking a lot of alcohol to mask the pain too. And so on that first visit, which I typically don't make recommendations, my first visit is for me to gather information, but, and do labs and that kind of thing. But for her, I said, you know what, let's start I gave her the 5-day Quench plan. And that was all I did with her. And I said, I'm going to see you in 2 or 3 weeks. We'll go over all the blood work and figure out a way to where we're going to go with this. She comes back 2 weeks later and literally jumping up and down at the front desk saying, oh my God, I feel so much better. And all she did was hydrate a little bit better. That was just the start of it. Now, a year later, she's not drinking, now it's almost 2 years later. She's not drinking. She's doing she is functional completely. She's turned her life around. But it was that small impetus that she needed to make those changes, then that she really done the work over the past next year or so. But she was dramatic. And I see dramatic all the time in really sick people, where people are not feeling good. The other case study I love in the book is the, there's quite a few. I love the one with the airline stewardesses. My patient who's a stewardess, which is the most dehydrating environment, as we know. So I told her to start making some chia seed drinks and hydrating better, and doing, just really turning her on to how she can hydrate with food and hold on to that hydration better. And she came back and told me that she has all the stewardesses drinking chia seeds, bringing them on the plane. I love that story too. They're all dramatic.
Oh God.
Yeah. So yeah, there's and I'll give you one more too, because this one incorporates two things that I think are really important for me as an integrative doctor. The kid with asthma and really obese person who couldn't lose weight, and we had started we put him on an elimination diet, meaning we got rid of gluten and soy and dairy, and corn and a few other things. And we hydrated him better. He started doing some green smoothies, and his life turned around within a few months, completely turned around. And he's doing phenomenal. So
I think one really curious thing that happens when physicians recommend hydration as their first intervention is that it then energizes many other changes. In other words, people literally have enough cellular feel better that they can go on to practice a better diet. They can go on to moving a little bit. In other words, the lockdown that they're stuck in, the malleability of hydration in their system allows them to actually cognitively be able to have the cognitive energy or the emotional energy to move into new practices, and in small incremental ways. And so, but that first intervention of hydration is what we're really trying to get people to get to. So
absolutely. We talked a lot about that too when we were writing the book. You remember, we really talked about wanting this to these small changes can have huge effects, and then become, a rolling stone into that better direction. It's funny.
I didn't mean to interrupt you. Go ahead. What were you going to say?
No. I was going to say, I gave a lecture just this past week to 60 women in finance. And these are heavy hitter women, and afterwards, one of the women came up to me and she looked at me and she's like, this I can do. And she was so relieved that it wasn't a huge lifestyle change, a huge plan. But you know what? The truth is, the secret in my mind is, she's going to start here, but she's going to go on and then make some bigger changes and really, really get that ball rolling. But yes. This is, we said it too, this is the first step in any, before you take on any nutrition plan, any diet, you need to start here. It sets the stage then for whatever you're going to do that's going to really help you improve your health. And if, I want to just say it out loud because I don't think we said it. This chronic low-grade dehydration is, treating that is the best thing you could do to treat and prevent chronic illness. And I think it's that important for people to hear. So the first step in treating and preventing chronic illness is proper hydration.